Good evening. I'd like to call to order the City of Oconomowoc Council meeting, Common Council meeting for Tuesday, July 6th. Would you all please, has appropriate meeting notification been made?
Yes, Your Honor, it has.
Thank you. If we could stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Call roll, please.
Alderman Krozik,
Present.
Alderman Zappel. Present. Alderman Ellis.
Here.
Alderman Spiegelberg.
Here.
Alderman Mulder.
Here.
Alderman Shellpepper.
Here.
Alderman Kavieski.
Welcome, everybody in the audience. If you'd like to make a public comment, there are blue cards in the back of the council chambers. If you could please fill those out, and one of our staff folks will pick them up for the comments and suggestions from citizens section. First, I'd like to entertain a motion to approve the minutes of June 15th, 2021.
So move Zaffel.
Mulder, second.
Favor?
Aye.
And we'll move on to our Lake Area Free Clinic presentation for today. We have Mary Reich and Megan Welsh to share some things and give us a perspective of some things in our community. Thank you for joining us.
Hi. Thank you, Mayor and City Council members, for allowing us to be here tonight. We just wanted to share.
Into the microphone a little bit. Thanks, Mary.
Thank you. We wanted to share a little bit about the Lake Area Free Clinic and invite you in for tours on your own. Megan's going to be talking about some opportunities for that. So we're celebrating our 20th year this year. It was actually July 3rd, the day of the parade at 5 o'clock that we opened 20 years ago. And so the clinic started when a group of emergency room physicians at Oconomowoc Memorial documented 1,800 people using the ED as their primary medical home. Obviously not good medical care and the most expensive. So they put together a task force to see if there was a need for a free clinic in Oconomowoc. And so they tapped Dr. Bernie Schumacher, a retired physician, and his wife, who was a retired public health nurse, to head that task force. And they ultimately ended up being founding board members, starting that clinic. So the clinic serves Waukesha County residents who are uninsured and at 200% of federal poverty level and don't have any insurance. So if they're eligible to be at our clinic, we are their medical home. We provide all their chronic care, their specialty care, and their medications, x-rays, CTs, MRIs, and follow-up. So being part of our clinic is also we are independent, solely supported by grants and donations, but we are strongly supported by ProHealth and Aurora. Aurora provides all the CTs and MRIs for our patients, and ProHealth provides labs and x-rays. So without that community connection, we would not be able to provide the services that we do.
Mary mentioned Betty and Bernie Schumacher, and I don't know how many of you were at the parade on the sweltery Saturday evening, but yeah. Betty Schumacher, who's now 92, was in a hot little red convertible, and she was representing the Lake Area Free Clinic. So she's still around and still working for us, just dedicated like crazy. So 20 years later, we have served more than 8,000 individual medical patients. We've had more than 56,000 patient visits on the medical clinic. We've had more than 110,000 hours of community service, volunteerism, and through pharmaceutical companies allow us to write and document information on patients so that we're allowed to get free medication for our patients. And that has been such a blessing to us. We've been able to secure over $4 million of free medication for our patients in the past 20 years. And that pays for about 80% of our budget for medication every year. So our line item on the budget is between like $40,000 and $48,000 a year that we write grants and do fundraising for the other medication. But if you can't afford a doctor visit for $300, you probably can't, or $150, you probably can't afford $300 of insulin. So we provide free medication because it allows patients to be compliant, retain their dignity, and get the care that they need.
So as I mentioned earlier, the clinic, all the care at the clinic is provided by volunteers. We have over 230 volunteers that provide this care. We have a staff of less than 4 full-time equivalent that support those volunteers. Myself, Megan, who does fundraising and grant writing, a volunteer coordinator, case management, and a nurse practitioner that we pay to be there every night, the threat of continuity. So when a patient comes in, they may see a different doctor every night, but we have that nurse practitioner there to provide the continuity along with the case managers. We're also affiliated with WCTC. We have the nursing students, the health information technology students, and the interpreter students. And on the dental side, we have the dental assisted students and the hygiene students, and we have a Marquette University extern. So we have many different affiliations in the community with that, and we don't duplicate services. So we have partnerships and resources in the community. If somebody comes to us and needs something that already exists, we simply connect the dots to public health or other resources in the community.
And Mary mentioned that we provide specialty services as well. So once you come to us and you're established as a patient, you are our patient. We're your medical home and your dental home. So let's say that you're established as a patient, you come in and you need cardiology. We have, in the building, we have cardiology, hepatology, hematology, dermatology, nephrology, neurology, orthopedics, physical therapy, diabetic clinic, orthopedics, mental health, and some other ologies also, so.
That's good.
All these services exist simply because somebody came forward and said, I'm a psychiatrist, how can I help? And that's how we're able to offer mental health, for instance, and all of the other specialties. Another specialty that a service, I guess, that our clinic offers as part of the eligibility screening when patients come in is if they may be eligible for Badger Care. If you remember, with the Affordable Care Act, for the first time, childless adults are eligible for Medicaid. So if they may be eligible for that, we facilitate that application, teach them how to use it, and make sure they're connected to a primary care physician. And so if the more people we helped enroll in this service since 2015, the more phone calls we received saying, okay, I was in the emergency room with a tooth infection, they gave me antibiotics and told me to go to a dentist, and now I have Badger Care, and that has dental coverage, but I can't find a dentist. And so I remember the day a 30-something-year-old patient who was our patient had gotten Badger Care, and he was computer literate and called and told us the scenario that I just described, and we said, well, you just go on the website and the listing is there, and he said, I did that, I can't find an appointment. So a staff member and I called 40 of the 56 listings and couldn't find him an appointment, and it made us ask the question, oh, that's not okay. So how do other clinics in other counties serve this Medicaid population? So our board, to answer that question, put together a task force, and we spent about 1.5 years looking into that in national conferences, engaged the local dental community and others, and that's how we came to provide dental services. So our dental clinic, the greatest need was with the Medicaid population. So our dental clinic, where the medical clinic is all volunteers with a small paid staff, the dental clinic is all paid staff with some volunteers. We wanted to serve as many people as we could. So it is fully staffed with the equivalent of 2 to 3 dentists every day, 5 days a week this summer, otherwise 4 days a week. So we serve Medicaid and uninsured. The uninsured have a copay, so there's nothing free on the dental clinic that way to allow us to be sustainable. The services, we started out intending to just provide the basic services of hygiene, education, extractions, and the periodontal treatment and surgical extractions, and found that you don't want to take out somebody's front tooth and then not have a smile. So we started to do partials, and then the root canals, just the front teeth, and now we do back and the rear back teeth also, and also some limited denture supplies. So it's growing. And crowns, yeah, so the crowns too. So it's because of the need that we saw and the services that were needed the most.
And the reason we had such a hard time, or patients had such a hard time finding care with Medicaid, is we nobody can seem to give us an exact number, but the reimbursement number that gets thrown around is 29 cents on the dollar, and it hasn't changed for many, 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 many years. So even if you have a servant's heart, if you're a dentist, you can't, not many business models support that 29 cents on the dollar. But for us, for a free clinic, 29 cents sounds really great as opposed to zero. So we encourage Medicaid patients. It helps us with our sustainability. And then, as Mary mentioned, then the uninsured do pay a copay, and that's so that we're able to exist and be here for them in an affordable way. So 20 years later, or I shouldn't say 20, because this is about the dental clinic now, just since opening in November of 2017, in the dental clinic, we've served more than 2,200 individual patients. We've had more than 15,000 patient visits, and we provided over $5.7 million in dental, retail value of dental patient care. So we could talk a really long time, but I think we're gonna pause right there. I don't know if you take questions, or I don't know, I haven't come to one of these for a while.
Council, do you have any, it's great for everyone to be aware of this. Oftentimes, we don't see the need, and we appreciate you sharing it. Alderman Ellis.
I remember when the dental office opened up, I was there, and I didn't know the back history on that, and that's outstanding. Thank you, guys. Thank you, thank you, thank you.
And thank you for coming to our opening, because you gave me a great segue for the next thing I want to say. We'd like to have all of you, in addition to Calvin, or Alderman Ellis,
Whatever.
come in, invite you in for a tour. We've got an open house on the 17th, which is a week from Saturday, from 11 to 1. The Oconomowoc Lions Club is going to be serving up burgers in the parking lot, and if you're able to pop in, anybody here, please do. If you are unable to come at that time, we're happy to have you come in for a tour anytime. Just give us a call. We also have our gala coming up on September 11th at the Ingleside in Pewaukee. So those are just some ways that you can help us spread the word, because we are here for the community, but we're only here because of the community. We couldn't do it without your support, so thank you.
Alderman Rozak? You have
That
a
was the
question?
question, was the tour. That's on, the open house is July 17th.
Yes,
You said 11 to 1?
yes.
Okay, great, thank you.
And if you're not able to make the tour or the open house, now you know a little bit more about the clinic, so if you know somebody that needs that service, please let them know and share.
In addition, they're happy to give any one of you a personal tour, so just give them a call.
Yep.
Thank you so much for sharing.
Thank you.
Thank you.
Thanks for
All
having us.
right. Let's move on to our next item, which are comments and suggestions from citizens. I don't have any comment cards or comments from the citizens unless there's one I'm missing. We have all these people, wonderful people in the audience, so I wasn't sure. Okay. We'll move on to consent agenda items. I'd like to entertain a motion for the easement to allow an ADA ramp in the city's parking lot, basically the Mullins Dairy Bar.
So moved.
Second.
Ellis?
Zaffel.
Any discussion? All in favor?
Aye.
On to committee reports. We'll start with Public Services. We'll consider act on Resolution 21-21R2965, awarding the skate park concrete flat work contract and approving the budget amendment. Just remind council that this is a budget amendment vote. Mr. Hepner.
Thank you, Mayor. As we mentioned in committee, the skate park is going very well. We have the major parts are going to get done soon with concrete, but we have some additional features that the committee wanted to see happen, and one of them is extra concrete. One piece we're calling a skatable pedestrian pathway, which will lead right from the parking lot up to the skate park, and then there'll be some seating areas with flat work, and then there'll be a shade structure on top we'll talk about next. So bids were publicly advertised. We received 2 bids. The low bid is RB3 Inc., which we're very familiar with, working with this year. They put in the concrete and installed the shelter at Roosevelt Park. They do a great job and provide a high-quality product. So they would be installing the skatable pathway, the seating areas, and footings for the shade structure. We did work with them on one change order. We're looking to remove the colored stamped concrete from this project and reduce our pathway down to 10 feet, which will provide a savings of $15,000. As of tonight, we had $412,000 in our account so far. You were here for Craig Schiffelbein. He presented another check for $12,000 and other commitments. So we now have about $87,000 currently in our bank account here at the city, with more commitments coming in yet. So we have covered this contract. So with the contract, there'd be a change order of the $15,000, as I mentioned, for a total of $74,200 plus a 10% contingency for a total of $81,620. And tonight, we're asking for approving the resolution, and as the mayor mentioned, a budget amendment for that $81,620.
Do you have any questions for Mr. Hebner? Alderman Rozak?
Just one comment. Thanks for all your work on this. I note that Alderman Kavieski's not here tonight, and I would like to thank him. I think he probably, I know he's on family vacation, probably would love to be here for these last two pretty big votes. I think there's the kind of commemorative wall yet to do, but these are the last kind of two big votes that really push this thing over and to see the last money coming in. And I want to thank Lou for his leadership on this issue for a couple of years and really continuing to push it aggressively and going after it and getting people involved. And I think he did a good job. And it's hard to bring together that much money and that many people and resources. So kudos to him and to city staff and everyone else, including Mr. Shufflebein, who came tonight. That was kind of a cool presentation when he brought the check. It should have been bigger, though. Like, it was really small. Like, you tell him to give a bigger one next time.
I'll work on that. As long as
Yeah.
the number's bigger, it's okay.
Yeah, that's true. That's true.
I do want to compliment Craig, Lou, and the community. He mentioned there's 84 different people or organizations that have given at least $1,000 to this project. So that's a lot of different people in our community. It's very generous, and there's more to come. We're seeing more coming in. So we're looking at about a $450,000, give or take, skate park, which we had talked about being about a $250,000. We've almost doubled that, and it's going to be fabulous. If you have a chance to look at it or get out there, they're willing to talk to you and show you a little behind the scenes if you'd like a tour as well.
I'd like to entertain a motion, please.
So moved. Rozak.
Alder, second.
Any further discussion? Call the roll, please.
Alderman Rozak?
Aye.
Alderman Zappel?
Aye.
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 Alderman Mulder?
Aye.
Alderman Shuffler?
Aye.
On to our next item, consider act on Resolution 21-R2966, awarding the skate park shade structure contract and approving the budget amendment. Mr. Hepner.
So this is a 30 by 30 shade structure that would be kind of between the old pad and the new pad at the skate park. We also publicly advertised this. We received 2 bids. The low bid is commercial recreation specialist who'll be using shade systems at $18,550. We've kind of talked about some of the financing already. So we're looking for approval of this resolution and a budget amendment of $18,550. Also knowing that any approvals are contingent upon receiving sufficient donations to pay for it.
I'd like to entertain a motion.
Rozak moved.
Mulder, second.
Any further discussions or comments from Mr. Hepner? Again, this is a budget amendment. Call roll, please.
Aye.
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 Alderman Mulder?
Aye.
Alderman Shuffler?
Aye.
Thank you.
Thank you. Thank you for your hard work. On to consider act on Resolution 21-R2967, awarding construction management services for the 2021 Olympia Fields Phase 1 infrastructure project. Mr. Fry.
Thank you, Mayor. Item before you tonight is for the construction management of the Olympia Fields infrastructure project. June 15th, we awarded that to Wolf Construction. It's a little bit over a $3 million project. We're here tonight to talk about the construction management part of this job. So the project was designed by R.A. Smith National. They then provided us the hours that they anticipated for the construction management portion of this. We reached out to our city engineering firm, Rooker & Milkie, and had them submit a cost versus doing a broad advertisement looking for additional firms. The reason for that is that there's been a team of city staff and a couple different engineering firms, the owner, a lot of people involved in this project over the past year and a half. And we felt it very important to keep this team of people together as we go through and do this. There's a lot of moving parts to this when you get into assessments, and we're putting in the infrastructure for a private developer, which generally, we're not involved in that. So all the different components of this, it just made sense. We did follow our process in the fact that it was the design engineer that provided us this. So we are not having the design engineer do the construction management, which is very important to the Common Council. And then we use those costs. The cost came in at $219,000, almost $220,000. We're asking for the 10% contingency on top of that for a net cost of $241,945.
Like to entertain a motion.
So moved, Rozak.
Second, Zaffel.
Any further discussions or comments for the public? Alderman Zapfel?
I just want to thank Mark, Bob, Jason, Stan, everyone else here at the city and your team for all the work that you're doing on this. This past weekend, there was a lot of chatter on that, getting a lot of questions. People are excited and looking forward to seeing the next phase over at Olympia Fields and what's to come. So thank you.
Thank you.
Alderman Rozak?
Yeah, just for the public watching, my understanding is because the RFPs for professional services, we're not required to put it out for a bid.
Correct.
So anyone that's watching it concerned that, oh, you didn't put this out for a bid, it's not required for professional services by state statutes. And this is in compliance, as far as I'm concerned, with our stated policy from several years ago that the construction management who's watching the construction is different than the guys who design the construction. And that creates that backstop that they're watching the design engineer do the work. And can tell us if the design engineer screwed something up, which is why it's costing more. So I appreciate your efforts in continuing to work with that policy, Mark.
Thank you.
Any further questions or comments? Call roll, please.
Aye.
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 Okay, and move on to consider act on resolution 21-R2968, awarding installation of rectangular rapid flashing pedestrian crossing signs on Highway County Z at Goldfinch, Renfield, and approval of budget amendment. And again, folks, remember this is a budget amendment vote. Mr. Fry.
Thank you, sir. The intersection of Goldfinch and Renfield up on County Trunk Highway Z, so this is on the north end of the city, has been a topic of discussion for several years. As that area developed up there, the residents reached out, a few years ago, wanted us to do what we could to get some better signage up there for the people that needed to cross. The sidewalk on the north side of Lake Drive stops at that intersection. So if you want to continue to the east, you do have to cross the street. So they've reached out. We reached out to Waukesha County, as that is their jurisdiction, requested them to put in signage and then also some pavement markings, of which they did. A couple years later, they came back to us, the residents, and said, we're not seeing people stopping when we're here. Can we upgrade this somehow? So this was back in Alderman Spiegelberg will remember, Alderman Zwart reached out and said, hey, can we do something different to make the intersection, the crossing more visible? So we worked with Waukesha County. They provided us a permit, which allowed us, the city, to purchase and install flashing LED signs. So these are the pedestrian crossing signs, the big yellow signs that have the LEDs mounted around the perimeter of them. Once again, after they were in place, we were hearing that they didn't think they were being very effective. So we once again went and studied what is possible out there. Once again, remembering that it is Waukesha County's jurisdiction. And as a matter of fact, there was a request for a four-way stop sign to go in there, and Waukesha County reviewed that. And based on the traffic and the requirements that, are in the manuals that, places use to determine proper placement of signage, it did not warrant a four-way stop. So we're moving forward to, once again, add something extra up there that should bring people's attention to the lighting. Actually, one of the residents up there also had requested something like this while we're in the process. So this was not a budgeted item. It's $7,500, and so we're asking for the approval to purchase the rectangular rapid flashing beacons, or RRFBs, as I'm sure you all call them, to put up there. And then also the budget amendment for it. We had no indication of needing something like this when we had completed our budget.
I'd like to entertain a motion.
Mulder, so moved.
Second, Spiegelberg.
Any further comments or suggestions?
So I think this is really, it is really needed. It's in District 1, and if you're not familiar, it's about a mile run from Piggly Wiggly on P over to the bypass, and that's the main way for anybody that lives in those many, many apartment buildings and the hundreds of houses that are now out there to get anywhere, is to get to that bypass. It's 35 miles per hour. I don't think that's the typical speed you'll find there. And we put a park on the other side of the road across from hundreds of houses, and this is the only way to cross that street. And I walk the dog there, and it is not well lit. And so I went and checked these out over at the courthouse, and I pushed the button and cars came to a stop immediately. So this is gonna be a big improvement. So there was a, if you remember a few meetings ago, there was a petition with hundreds of signatures on it requesting these type of actions. So thanks, Mark, for jumping on this, and I fully support it.
I'd just make a quick comment to echo Alderman Ellis, his comment that $7,500 to keep an area safe. This is a pretty simple decision from a big picture look. I'd like to call roll, please.
Alderman Rozak.
Aye.
Alderman Zaffel.
Aye.
Alderman Ellis.
Aye.
Alderman Spiegelberg.
Aye.
Alderman Mulder.
All right.
Alderman Shell Pepper.
Aye. Thank you.
On to, thank you, Mr. Fry. On to mayoral appointments. With the departure of Alderman Rogers, it's important that we keep our committees full so that we can have quorums, as well as making sure that all of our council meetings are attended. So I've asked 3 aldermen to step up and add more to their plate, and they all 3 were wonderful to say yes. So I'm placing Alderman Shell Pepper as Secretary of Protection and Welfare. Alderman Ellis is moving to the Chairman of Public Services, and we're adding Alderman Zaffel as Secretary, and Alderman Kowalski is coming on board on the Technology Committee. So thank you all for doing that. And in an earlier committee meeting, I also want to make the announcement that we are going to reinstate and have Alderman Shell Pepper stay on the Police Commission for the remainder of this term as well. Thank you, Alderman Shell Pepper. Moving on to staff reports. Any staff reports? I'm not aware of any. Matt, do we have any? No. Okay. Then let's move on to Alderman, comments from the Aldermans. Any comments from Alderman?
Go Bucks.
Yeah, half hour into the game.
Game starts in
You
3
bet.
minutes.
Oh, it starts at 8. Oh, okay. Okay. Well, I'm going to make a comment under the mayoral comments, is that I think today illustrates that is, as we're a growing community, we have a lot of intersections that aren't as safe as they should be. We have a tunnel that should be open with $845,000 of assets under the ground and is not useful. It's something that we're all working hard on. I want to make sure the community knows that. And I think the whole council is very supportive of trying to make these safer. I've learned a lot in the process working with some wonderful people at the DOT, but it's a system that doesn't lend well for us being proactive. It's a system when bad things happen, then you get the funding. Well, we're working really hard, and I'm adamant that we are proactive to try to fix these problems. And tonight, I'm really happy with what we did at Goldfinch, and we're making progress. Is it perfect? No. But if we just let it go into the old systems within municipal government, kind of shame on us. So we're going to work hard. We're going to try really hard to get some of these things going forward. There are a lot of things that have been in the works, especially on the tunnel, for 3 to 4 or 5 months. We haven't been successful yet, but we're going to keep pushing. I'd like to entertain a motion for adjournment.
So moves Zaffel.
Shell Pepper second.
All in favor? Aye. Go Bucks.